Hi, welcome to this edition of our virtual care webinar series. I'm really excited to have you with us today as we sort of take a detour from our normal type of topics, and we're going to dive into sort of geographical differences around the globe and what can we learn from one another in terms of virtual care. So with me today is Robert Denson. I'm so excited, so stoked, Robert, that you're here with us. Here's a little bit about Robert, but I'm going to ask him to introduce himself. This is the first in a series where we're going to focus in on the Middle East this fall and just learn from a lot of different leaders like Robert about what's going on there, what are some of the best practices we can bring back and apply to what we're doing in different geographies around the world. So with that, welcome, Robert. Why don't you tell us, I know we've got your slide, but tell us a little bit about yourself and how, I think people will be interested too, how to tell us about yourself. And if you forget, I'll ask you the question again because it's a two-parter, but how did you obviously came from the United States. How did you make your way over to the Middle East? And tell us all about that. I think it's quite fascinating.
Thank you. Thanks for having me, Ed. I appreciate it, and I'm looking forward to our conversation today. My name is Robert Denson. I'm the SVP of IT and Operations here at Malawi, which is the first HIE in the GCC countries. So it's the Gulf Coast countries. So, you know, it's UAE, Saudi Arabia, and Oman and a few other countries here in this region. And so we're the first HIE that has been set up here. So a little bit more on my background, I was the Chief Information Officer of CREO, which is the Colorado Regional Health Information Organization. And so, you know, I'd been there for a number of years. You know, the company's been great and, you know, a great HIE, well respected in the United States. And, you know, an opportunity came here to, you know, build something from scratch. And I thought, you know, we have a daughter in college. She just finished. So, you know, we were like, all right, it's time for empty nesters. You know, why not take this opportunity and build something from scratch? And also, you know, you're in a great place to travel the world. So we've done a lot of experiences and been able to, you know, really, you know, fall into a whole new culture that we hadn't expected. So it's just an unexpected opportunity and perfect timing for us as a family.
Yeah, no, that's great. I always admire people who take risks in life, you know, move to different, sometimes it's just moving to a different city, sometimes moving to a bigger state, but you actually like left the country completely in a completely different culture. I think that's pretty cool. So this is a reminder that we are live, and we do live for two reasons. One is so we can engage with you. So if you have any questions, you can enter them in your side panel. We'll be looking at those questions throughout our short time together, and we'll definitely engage with you. So to the extent that you have a question, something's on your mind, please input that. We also had a question come in beforehand, and we will address that one as well. So feel free, I'll probably remind you one more time as time goes on. So I think the general sense is that in many ways, the Middle East, or certainly parts of the Middle East, are more advanced when it comes to virtual care, sort of digital transformation. So I'm really curious, now that you've been there a little while, Robert, what's your take, having both the United States experience and now the Middle East experience? Are there areas where the Middle East in general and where you are advanced, and are there areas where the United States is more advanced?
Yeah, so, you know, definitely from a digital footprint standpoint, especially here in Abu Dhabi, where I reside and where I'm a resident, many facets are much further ahead than the United States. You know, for instance, you know, on my phone here, I can pull my driver's license up. I get my car registration on here. In fact, I get my speeding tickets on here too. So when those come in occasionally. So from a digital footprint, you know, that they are looking at everything from a digital first standpoint. You know, from a healthcare standpoint, you know, certainly I think the area that they're head is, you know, by nature of the government here and the policies that they're able to push forward. You know, take the HIE, for instance. In Colorado, you know, while we had state contracts, right, to onboard providers, you still had to sell the health information exchange in order to get people to onboard and share data, you know, especially when you talk public and privates, right? Yeah, I think many folks understand that from a challenge. You know, every state's a little different in that aspect. In fact, we're here, you know, we have a policy that basically everybody, if you're a licensed practitioner and provider here in Abu Dhabi, you're obligated to participate in HIE. So they have to onboard with us. So, you know, from a data acquisition standpoint, it's a much different conversation. And quite frankly, I think it advances where we're at from a data standpoint, you know, in order to provide good information to providers to make better informed decisions, right? And then ultimately the regulator to make decisions based on that. So from that standpoint, it certainly has helped. You know, from a challenge, and especially when you're talking virtual care, you know, one thing that still plagues us, you know, and I think I remember lots of conversations of this in Colorado, and I'm still having these conversations here. So, you know, we haven't been able to win this battle yet. But data standardization is a challenge. You know, coded values for many different data domains. You know, there's still a challenge. One thing that I found extremely interesting here compared to the U.S., especially when we were building the health information exchange, addresses. You know, I don't have a home address here. So when you go to the hospital, right, trying to geolocate the position people within a community is a challenge. So you even have to do some different things around looking at creative ways where you can enrich your master patient index. Most of us in healthcare are very familiar with that. It's key to a lot of our work, right? So you have to take things a little bit differently in that regard. So it's a very interesting challenge that we continue to work through with the regulator and our providers and trying to get us to a better spot.
Yeah, and I think one thing you had mentioned as well is that the advantage you have as well in some locations in the Middle East, certainly where you are, there's a trust in the government, right? And we're not being political here at all, but it is there's just that, right? It's part of the culture.
It is, you know, that's extremely important aspect of that policy, you know, where, you know, I have maybe a healthy distrust of the U.S. government, whether it be federal or state, doesn't really matter, right? I kind of want to keep them away from whatever I'm doing. Where here, people have a strong trust in the government. And I'll tell you, you know, even in the COVID response, you know, it's very apparent that people trusted the government, you know, and quite frankly, too, on that same token, you know, you're a little concerned about some of your actions, you know, again, not political, but if you didn't wear a mask out in public, you could get fined. And I had no doubt I would get fined if I went out in public without a mask. And so I'm going to follow those rules, right? Where in the U.S., I think those are a little gray, you know, depending on what state you're in at times. So, you know, I found those, it's a very big difference. And some of the things that you can get away with in the U.S., you wouldn't dare here. But, you know, when you look at these cities and what they've built in the last 50 years, why wouldn't you trust the government? You know, they're doing some amazing things in this region.
Yeah. Yeah. And the reason we bring that up, again, is not political at all, but simply understanding the cultural context for some of the successes and sometimes some of the things that you might be behind on, you know, has a lot to do with policy. And so policy can definitely be a great helper. You know, one of the questions that came in, and I just think that others will have the same interest, is really two. One is, we've seen in virtual care in the United States, you know, we went from literally statistically, if you measured it, 0%. Now, obviously there were some people doing some things, but it was very, very small. And we went up to, you know, there's been some good empirical research that was reported recently. And then I've done a lot of anecdotal things with a bunch of different CIOs. You know, some organizations hit a high watermark of 80%. I think the average was probably about 50%. And since this time, even though the pandemic is still as real as it was in March, we've gone down to 20% in the United States. I'm curious if you had any sort of gut feel about how things are in the Middle East, and where do you think it might end, just based on some of the experiences that you've already had?
Well, I know from a regulator standpoint, they are certainly pushing virtual care. In fact, what I appreciate here is the government didn't wait for the hospitals themselves to stand up a virtual care platform, right? They wanted to ensure that their patients were being taken care of, right? All residents and citizens. And so they put together, they have a government-led virtual care platform that is, funded by the government. And so any patient can jump in there, and then they have certain, providers that are working within that virtual care platform for care. So from that standpoint, the government is going all in into virtual care and pushing that, not pushing, but advertising it to the market and ensuring people are aware of that option. And then likewise, they're also asking the hospitals, right, to continue what they're doing in that domain too. Now, I do believe it's probably not that 80%, but I also know through some of my, I don't have the stats around it, but some of the work that I do with some of the hospitals, some good names here, is they're still continuing those virtual care. And in fact, those high risk patients, they're recommending them to keep that virtual care in place rather than coming into the hospital. So they're still trying to ensure that, the safety is still there for those certain segment of patients, right? Elderly, diabetes, cardiovascular disease, those type of incidents. So from a gut feel, I think it's probably above that 30% mark. I couldn't tell you how much further though, without any confidence.
Yeah, I would suspect, based on what you shared already, that it's going to be a higher percentage. But yeah, it'll be interesting to sort of track that. And we're gonna come back in a second. So Robert, I'm kind of giving you a heads up about not the next question, but the question after. What are some things that you would do differently now when you come back, if you were to come back? But before we get there, there's one more question that came in along the same lines of what we were talking about. And there is a cultural difference. So that's why we're talking about it today. Obviously, this is about what's happening in the Middle East, trying to understand, best practices, what can we learn? But also, it'd be interesting to see, if you have an opinion on this, where we're seeing with virtual care that the elderly, while they adopted virtual care, my dad, we all have parents that we typically use as an example. My dad's in his late 80s, independent. He uses virtual care because he had to. But now that he has a choice, he prefers to go in because that may be the only social, he's a very social person. And so he loves, getting in the car, driving to his medical center in Colorado and getting care and joking around with the medical staff, so he loves that. And so in the Middle East, the family construct is different. And so socialization, because you might live like within your community, and family is, I gotta be careful how I say these sort of things. People, oftentimes you live with your relatives, and where in the United States, we tend to be more we don't tend to be quite like that. So the question really is, how can virtual care, so what's your observations, just kind of like on elderly care? Is it the same here, that they would prefer to go in, or because they already live in the context of their family, typically they're getting some of that socialization? And then for those situations where they're coming in, is there a way that we can use virtual health to bridge the gap across all ages, or maybe it's not virtual health specifically, but the social aspects of virtual, if that makes sense?
Yeah, I think it does make sense. It's not an easy question to answer. Especially out here, there are strong family units here. Family is much more, I hate to say this, much more important than I ever, engage with my family in the U.S. My mom lives in a different state, and we see each other, once every couple of years. My brother's in a different state, same thing. We're here, they have strong family constructs, very close-knit families. But going to the virtual care piece, with that being said, I think you know, though they have strong units, you know, they may not know what others in their same age range, you know, that are across town, you know, that are getting treated for the same type of illness, you know, their doctor may have them on a whole different treatment plan. It'd be really interesting is, you know, if those groups could come together, you know, as patients and even speak about what's working for them, what's not working for them, and be able to take those back to their providers, or even a group setting with a provider or a group of providers with, you know, some people in the same, you know, age demographic, right? To discuss those different care plans or outcomes that are happening or not happening. You know, I think there could be some power in that. You know, I remember a conference that I've been to years ago where, you know, there's so much information coming to providers now, they can't possibly read it all. So they're probably all doing different types of treatments for different conditions, at least in some regard, right? And there's standards that everybody's going to follow. But certainly, you know, when you kind of get in group settings, you know, two brains are better than one, you know, the simple saying, right? I would leverage that in the same within an age group. And quite frankly, too, could be in other age groups, you know, especially, you know, I hate to keep going back to COVID, but, you know, that's in the news and I've read a lot of articles, I feel like, and, you know, some of the things that are affecting, you know, different age groups are now hitting other age groups, right? You know, it's just becoming more prevalent. So those treatment plans need to be shared and worked through, you know, the different populations.
Yeah, no, that's great insight. So we'll head back to sort of the lessons learned. So Robert, imagine 3 to 5 years from now, you have the best HIE in the world, maybe today, but we'll give you another 3 to 5 years. And you've
Fair.
learned a lot and you've seen a lot now. You've got a more global worldview. If you were to come back, let's say you came back to Colorado and whether it was HIE, virtual health, digital transformation, those sort of things, what are 3 to 5 things that you would bring back with you that you would make changes to what you knew before this experience?
Yeah, so, you know, first and foremost, I think something, you know, like I told you, one of the things here, you know, that we discuss, you know, the trust in government. You know, I have that healthy distrust, but I would do everything in my power when I came home, depending on the initiative, right? But if it's anything with healthcare, I feel strongly that, you know, the states, the Medicaid office, what have you, regulators need to get much closer aligned to the boots on the ground, people performing the care, you know, and I feel like with that, they can, if the right groups can get together and bring forward, you know, some strong policies that help move forward change, right, for the better. I'm a huge proponent in that. You know, it has to be done right. You know, we won't go into some of the other challenges of other initiatives that haven't failed, but you know, I feel like more can be done there, and more of the, you know, let's sit at the table and make sure we use our brains and put the right policies together in order to drive interoperability, virtual care, reimbursements on virtual care. You know, I understand there's still challenges with that. Even with some of the, you know, COVID exceptions that were made. So I think that's number one for me. A couple other ones that, you know, jumped out, you know, just me working, you know, here in the Middle East and UAE in particular. I understand some of the other countries around here, Qatar and Saudi Arabia, have very similar populations. Maybe not to the extreme here, but, you know, diversity. I have just around 70 people on our team, and you know, on that I have over 40 different nationalities in our organization. It's unbelievable when you sit in a room, you know, so many different perspectives, and quite frankly, you know, I think, you know, you can get some very powerful outcomes, you know, with those different perspectives, discussing issues and how to solve those issues. You know, one thing that I love about here too is, because everything is relatively newer, you know, they're always interested in let's benchmark against some of these other countries that have high marks. You know, benchmarking in Colorado isn't necessarily something I thought about a lot, but here, you know, a lot of things are being built from scratch and being pushed forward. So, you know, let's go look at who's, doing it well, do some investigation and benchmark against that, and let's do better. I love that. I love that mentality, and I'm going to take that home. And then, you know, one of the last things too is, you know, I've learned a lot in this region, especially around, you know, one of the challenges that I had thought about earlier, and I, you know, didn't say, but, you know, legal aspects, you know, I have not seen, so, you know, they follow a very similar legal framework as the UK, but they have a Abu Dhabi global market here. So one thing with that challenge, though, when I work with U.S. companies, they don't understand that rule set, if you will, right? And what's that mean? So, you know, I would urge anybody that's going to work here in the Middle East to understand that, especially if you're trying to do business out here. But I'll tell you too, one thing, we put strong protections in our agreements. You know, we have vast, you know, areas that we're covering, you know, from a relationship standpoint. So very strong legal verbiage. Quite frankly, some of those I could have used in my previous lives. So I will definitely be thinking about those in the next contracts when I go. So those are pretty big ones for me. Last but not least, you know, different sense of urgency. You know, you don't build cities like Dubai and Abu Dhabi in, you know, less than 50 years without a sense of urgency. So everything we do, you know, we have a good amount of pressure, and it's balanced well, you know, but there's a strong sense of urgency in everything that's done, and let's make it happen. You know, what roadblocks do you have? Let's work around them. Give us alternatives to those roadblocks, and let's get this done. So I love that.
Yeah, those are 5 really, really good things. And I want to maybe double click on the 4th one, which is how to do business in the Middle East. But before we go there, I just wanted to review and then add one comment. So we have about 5 minutes left. So if there's any other questions, and that was one of the questions that had come in previously, as well as, hey, how do I work in the Middle East? How do I do business in the Middle East? But just to recap really quick, because I thought it was powerful, sort of your 5 recommendations or lessons learned is one, you talked about the trust in the government and how to work with your local and state governments to try to endear that trust and working closely together. And the comment I had on that, Robert, was, you know, you can do so much and you should try and work with, you know, your organization and government relations, those sort of things. But also think about the philosophy you were just espousing from a brand perspective. So you can control your brand and build that trust with your community and your patients or future patients. So I think that's really critical lesson that can be embraced. The second you mentioned is diversity. You know, I've been running this separate series on racism in healthcare IT, and really that's been the common theme that's come out of those is, oh my gosh, if you don't have diversity, you are missing out. And obviously the diversity that you have with 40 different countries represented on your team is pretty amazing. And it's just so powerful. People should really, leaders must embrace that because it only makes you better and does better things for the patient ultimately. The third was to benchmark yourself. So they're very adamant about benchmarking in the Middle East, as Robert was explaining, and everyone should do that because that's how you know what your baseline is, how to improve, and you measure what matters. And then the legal thing, we talked about legal construct and the sense of urgency. So let's go into maybe one layer deeper, Robert, because you know some of the listeners to our webinars are a lot of provider side, but also vendor side. How would you get started? So obviously the legal thing's really important, but beyond that, how would you get started? So if you were to come to the United States, start a business, and you realize, hey, what you have to offer would be a benefit, let's say in the Middle East, what would be 1 or 2 ways that you might go about that?
It's a great question. I hadn't thought a lot about that one, to be honest with you, but you know, off the cuff, you know, I think you have to build a relationship with someone that's established here. You know, there's a lot of companies that are doing business here, and, you know, depending on what you are, if you're a software reseller or as developing new software, or if you're a system integrator, right? One, you should build a relationship, at least initially, to start to understand the area. I'm one person, been out here just over 18 months, but there's people who have been out here for quite a long time. They've built strong relationships. I think the relationship part is extremely important to help give you introductions, right? And then even help walk you through the process to become a registered company here, because there's certain rules that you have to, have a license here to do business, right? We even require people to register with our company to be a vendor, and then sign NDAs, that kind of standard stuff. But the company registration, I've seen a couple of vendors that have come out here and they struggle through that. So, having someone that has done it previously or is already established can help walk you through that type of process, right? And again, relationships are huge. Whoever you're dealing with, you have to have that warm introduction.
Yeah, no, that's good. That's good advice. So thank you for that. I think the last question, and again, we probably have time for one more audience question. So if you are interested in hearing some insights from Robert on virtual care in the Middle East, please go ahead and enter that question. The last one is career advice. So you made the decision, as you mentioned at the very beginning, you're sort of empty nesters, your wife and yourself seem like, sort of like adventurous. So you go and like not only just move out of state, but you move out of the country and Middle East to a different culture. From a career standpoint, now that you've had 18 months of experience, and you're talking to your 30-year-old self, as an example, so you're maybe a manager, director, working your way up, would you recommend that kind of experience to other people, and how might you go about investigating that?
Without a doubt, I would recommend it. Like I said, my daughter's just, just finished college, and I'm like, maybe you should come out here. It's an experience that you just cannot get in the United States, especially in a country like the UAE. It's extremely diverse. The people are kind. You're in a great place to travel the world as well. And you're going to experience a culture pretty in depth, that you're not going to get many opportunities to do that. So I would recommend it to anybody to come out and experience it, whether it's here, Saudi Arabia, or some place in Europe. I recommend any of those just because of the cultural aspects. I feel like I've learned more in the last 18 months than I have in my whole career, just working with people. It's huge. But then on that too, from a career standpoint and how to do it, I would look at, there's a lot of job boards in this area. There are recruiters that specialize out here. There's a lot of companies that, look to staff people for contracts they get out here, HCI being one of those. So I would urge people to look at those companies, that footprints, review, and see what kind of skills they are. There's certain requirements that you must have to get past security clearances and things like that. So, it's not necessarily open to everybody, right? You have to have some basics in place. So doing that little bit of groundwork and then reaching out to those companies, and, doesn't hurt to interview. That's how you're going to gain experience and understand even more, what type of person they're looking for, what type of skill sets they're looking for.
Yeah, no, I think that's great advice. It's very powerful when someone comes to your team and has these other experiences, not only from different companies, but from different parts of the world, for all the reasons that we spoke about. So if I could speak to my 30-year-old self, I wish I would have done that and had that opportunity. I sort of made up for it in different ways, but that's something that I would love to have done. Robert, this has been fantastic. You shared with us sort of where the Middle East is compared with North America. Talked about what's ahead and what's maybe a little bit behind. You gave us like 5 really practical things that I already summarized in terms of what you should do, like if you came back, how to do business in the Middle East, and then finally ending with that career advice, which I think is really powerful. And then we talked about virtual care as well. This has been tremendously enlightening for me. And I really thank you for sharing your wisdom and experience with us. So thanks a lot, Robert, for joining us.
Thank you for having me.
Yeah, it's been fantastic. And we have more webinars coming up, just a 30-second commercial, if you will. So we have our continuing discussion on race relations. We've been doing this for about 4 months. This time we're going to hear from a Black professional on the vendor side. So up until now, we've had a CMIO, we've had 2 CIOs, a woman CIO and a male CIO. Now we're going to go on the vendor side, and then we're going to go on the patient side, and then we're going to culminate in December, although the conversation will continue well into the future, as it should. Then we have one on digital healthcare transformation. It's about a recent book that came out. And then we're going to learn from Steve Lee what we can learn from other industries. This is going to be really interesting, Robert. Steve was the CIO of Singapore Airport and recently went to healthcare. And it's amazing the similarities because it's all about the experience. And then finally, we're going to talk about human-centered design with Amy Haymans. So anyways, thank you everyone for joining us and wish you a great day. Take care.